Hi everyone, today we will be presenting our integrative review on diabetes-related complications among Indigenous people. Our integrative review was conducted by Felicia, Hannah, Priya, Becky, and Francisco. Worldwide, Indigenous people face a heightened risk of developing type 2 diabetes mellitus and its associated health disparities. In Canada, an estimated 1.7 million Indigenous individuals experience notably increased rates of diabetic-related complications such as chronic and end-stage renal disease, retinopathy, neuropathy, lower limb amputations, foot ulcerations, and cardiovascular disease in contrast to the general population. The rising rates of diabetic-related complications and unfavorable treatment outcomes in this patient population originate from a variety of societal factors consisting of colonization, impact of historical trauma, geographical isolation, poverty, obesity, and educational disadvantage. Given that many Indigenous patients live in rural areas where access to healthcare is hindered, many times their diabetic-related complications progress more rapidly and severely than non-Indigenous patients. The implementation of preventative measures and early screening for type 2 diabetes in Indigenous communities is imperative. Since Indigenous people with type 2 diabetes are now being diagnosed at younger ages, prevention measures should be especially emphasized towards women of childbearing age, as gestational diabetes and maternal obesity present a large risk of type 2 diabetes and obesity to their children, which compose the future Indigenous generations. Reinforcing the importance for education and resources to be directed towards this population is essential.
To create our integrative review, Whitmore and Koffle's methodology was used. We searched multiple online databases as well as journal searching using 6 inclusionary criteria. Studies were included that were written in English within the last 15 years, published in a peer-reviewed journal, included participants that identified to be Native, Indigenous, First Nations, Métis, or Inuit, as well as a citizen of Australia, the United States, or Canada. The last inclusionary criteria was identified to be participants that were diagnosed or received diagnosis of diabetes during the time of study, as well as suffered at least one diabetic-related complication. These included peripheral vascular disease, neuropathy, lower leg amputation, retinopathy, renal disease, cardiovascular disease, and hematological imbalances. However, the variance of culturally appropriate terminology for identification of individuals who identify as First Nations provided difficulty in the accuracy of obtaining articles. During the collection of articles, they were evaluated by the type of study, adherence to the study design, sample strategy and size, conditions or measurement tools that were used, the validity and reliability of these tools, and the statistical tests and appropriate reporting of these tests.
27 articles were chosen for examination and inclusion in a review in our search criteria. 2 of the articles selected utilize a qualitative research design, and 25 applied quantitative methods. The qualitative methodology used grounded theory and phenomenology. The themes identified in the qualitative articles were used to guide the interpretation of qualitative results. The quantitative methods consisted of case control or cohort studies, descriptive studies, integrated reviews, literature review, and systematic reviews. The chi-square and t-test were the most common statistical analysis tests used to compare independent and dependent variables. The articles reported their results by way of confidence intervals, and the articles primarily reported data on the incidences of diabetes and associated comorbidities.
The diabetic-related complications that were investigated in these studies greatly differ, using a variety of complications as their dependent variable of study. This included foot disease, retinopathy, peripheral artery disease, neuropathy, cardiovascular disease, and end-stage renal disease, or a combination of these complications. However, there was no major divergence in the data, and the common theme between these complications is that they are all caused by diabetes and are all more prevalent in Indigenous populations. For the most part, the stated purposes of these studies are appropriately reflected in the statistical tests that are used. However, there are a few stated article purposes that are mismatched from the statistical tests used. These articles could have chosen better statistical tests to reflect the results that they were hoping to achieve. A variable of interest that was underrepresented in this review was kidney complications associated with diabetes. Additionally, due to the wide range of potential complications associated with diabetes, many complications that were investigated independently, such as peripheral artery disease, neuropathy, and cardiovascular disease, were possibly understudied in this integrative review and could be investigated further. Another gap that was encountered was the lack of Canadian-sourced articles. The goal of this integrative review was originally to focus on Canada, but there is not nearly enough Canadian research investigating diabetic-related complications in Indigenous populations in Canada.
A limitation that we found during our research was the fact that some studies only focused on studying the incidence and prevalence of type 2 diabetes and its related complications among Indigenous people, and they did not compare their findings to their non-Indigenous counterparts who are diagnosed with the same disease. But as we have identified through our integrative review, the Indigenous population around the globe are disproportionately affected by diabetes and its related complications. Therefore, we recommend implementing effective prevention strategies to mitigate these findings. For example, in collaboration with community leaders among the Indigenous population and funding agencies to engage with entire communities can facilitate implementing screening measures where Indigenous adults with additional risk factors, such as obesity or those who have a strong family history of diabetes, can have access to clinical care and significant follow-up action to prevent further development and diagnosis of this disease. So, in addition to early screening, prevention programs like the Diabetes Prevention Program in the U.S. can be implemented where proven interventions for all ethnicities can be offered. These programs focus on healthy behavior changes such as diet and exercise, as well as interventions aimed at increasing health literacy. And then last but not least, similar to prevention strategies, management of diabetes with Indigenous people should incorporate the social and cultural context of their community. So the results of this integrative review helped identify the diabetic-related complications and barriers that Indigenous people with type 2 diabetes experience. This knowledge can direct community-based programs to prevent as well as manage the complications of diabetes in Indigenous people, which will aid in building viable, healthy, and safe communities. For future research, we recommend that there be more studies done with Canadian participants, including Inuits and Métis, who are currently not identified as Indigenous, even though they face the same barriers as the Indigenous population. And that would be it for our presentation, and thank you for attending.